Hello, everybody. How are y'all? Will y'all let us know how you like that new intro? That was the first time I've seen it, and and I absolutely loved it. Great to see you guys. Hold on one second. Let me. Here we go. Okay, we're live on Instagram as well, I believe. All right, here we are. Grandma Mary snowed in at the Blake. Hope everyone over there is good. Y'all doing okay over there? D. Lynn, thank you. Thank you. Smash that like button, share, subscribe. The whole shebang. Roel, what's going on, man? Great to see you guys. This is I guess a very winter edition of the live Q&A show. So we'll see if people come in tonight. No matter what, if you're with us live, we're going to answer your question. We'll be here till around 8. And I think the Vols have a healthy lead right now. So I feel comfortable doing this show right now. Stan, what's up? Thank you, man. Thank you, guys. Cherry, what's up? If you're with us, say hello. Say hello to me. Let me know where you're at. Let me know you're warm wherever you may be. Tennessee has been super cold this week. Had some snow, and honestly, I think everyone's done a great job with it. What's up, everybody on Instagram? If you can see me, let's see here. We're letting some people come through. Thank you. Say hello if you're with us. We have a couple questions that came in throughout the week, and then we'll spend most of the show tonight on live Q&A. I think partly that's due just to kind of the strange week it's been. Montana, what's going on? Yes, a whole lot of snow. I know we're thankful for your 4-wheel drive. Wayne, what's up? Hello from Elizabethton. All right, E-Town in the house. E-Town, what's up? Michelle, hello. Great to see you from Oak Ridge, my old stomping grounds. Love to see you in here. Becky from Church Hill. Love Church Hill. Thank you. That's close to Kingsport, where my family is. Tim, my brother Tim in Alabama. I miss you, man. I miss our Starbucks dates. I really do. I can't wait to see you again soon. Up in Tennessee. Cherry, Jonesboro. Shout out to JRT. The Jonesboro Repertory Theater. I always forget that the R part of JRT. I always mess up. Molly, what's up? So good to see you. We're going to get Doc in here shortly. Real quick, I'm doing this for the crew here. We had a brand new episode of the Common Sense MD go out. That's our good friend, Jonathan Hauser, who's doing has an indoor garden. You guys just have to watch this because, and I'll let Doc talk a little bit about it. I've seen these garden boxes that he's creating, and they are just phenomenal. And Doc will talk more about this, but I enjoyed watching this, getting to see what Jonathan's up to. He's such a good friend of ours, and it makes me happy to see his passion around this, and kind of bringing farm to table to all of our homes. So super cool episode with Jonathan. And then our nutrition coach, Lucas Schmidt, speaking of JRT, did an excellent episode of Dive Into Diet on nutritional transitions. Funny enough, this this episode was about me. Some of my nutritional habits that need to change. Those of you who know me know what those are. Fries being one. Ben Thomas, what's up, man? Man, talk about a blast from the past. Ben, I can't think of a childhood memory with my brother and sister without you in it, man. So good to see you. I hope you're well. Hope you and your family's well. Sherry from Boozy Creek. I need to figure out where Boozy Creek is. It's got a cool name though. Lisa, what's up? Tabitha, what's going on over there in Kingsport? Hope you guys are warm. Let's bring Doc into the show here. We're going to answer all y'all's questions. Let's see here. I do have one more. Carter, what's up? So good to see you. Yes, Molly, yes. Super interesting about the gardening. I'm going to have Doc talk more about it. In this one, this brand new episode of Explain This with the star of the show, Robin Riddle, our nurse practitioner in the West Knoxville office, talks about Jim Nema. And if you watch this video, you'll notice your boy here had no clue what Jim Nema was. And, and the whole episode, I feel like most of the Explain This episodes, Robin's just helping me out. She helped me understand what Jim Nema is. So I hope you guys enjoyed as much as I enjoyed getting to record that with her. Anybody who has diabetes or struggles with metabolic syndrome or weight loss, that's an episode you're going to want to watch. It's not. I think it's an herb that we don't talk enough about. So a huge shout out to Robin for doing that episode. All right, let's bring Doc in. Let's bring him in. He's ready. What's going on, man?
Hey, Ben. How are you?
I am wonderful. We've got such a good crew in here live tonight, Pop.
That's what I just heard you saying. You had some Oak Ridge people. Ben Thomas.
Yeah.
That's a name I haven't heard in a long time.
I know. I'm just
hope he's doing great.
I am so pumped.
I remember a lot of things about Ben. He loves trucks and he loves tractors too, doesn't he? John Deere. He loves John Deere.
Ben, is that right? Is it John Deere? Are we getting that right? Man,
sure.
I hope he's doing wonderful. His whole family's doing wonderful. Huge shout out to the Oak Ridge crew in here tonight. Mason, what's going on? Terry, what's up from South Carolina? Margot over there in Fountain City, staying warm. Great to see you. Ben's a John Deere guy. I love to hear
That's
it.
what I thought. Yeah, I thought he was. I like your toboggan, Ben.
I'll tell you what. Today's a day to wear it.
Really is. Yeah, it was freezing here and a lot of snow. We had a great day though. We actually worked, did telemedicine, but all day long, so it turned out pretty good.
Yeah, well, it's been a very interesting week. Shout out to everybody. Hopefully everybody's staying safe on the roads. I know Knoxville, the roads are a bit icy, so stay safe if you're going to get out. Real quick, Doc, I want to bring this picture up, and then we're going to talk more about the indoor garden, because I want to know what that was like, because you filmed inside this greenhouse, and you could actually you could hear the fans. I felt like I was there. So I want to bring that up here in a second, but first we sent this out, and I'm already getting questions about it. We did a little section of Performance Weekly. As you guys know, every Tuesday that email goes out, and it was my beautiful mother who came up with the idea of why don't we do a section of what Doc is reading now. So we went through his to his chair, and these were the books we found. Which one are you currently in right now? Kind of speak to some of this.
Well, that was my Christmas reading. We take the week off after Christmas, and I'm really this year. I'm really going to get more into alternative treatments of cancer. Of course, along with the traditional treatments. In addition, what can you do to treat cancer? And the thing about the metabolism of cancer cells, they metabolize energy differently than regular cells. So this thing on how to starve cancer, and even the thing about mistletoe as an alternative form of cancer treatment is really fascinating me. So I really hope to get some good knowledge and things. I already have. I've already put a lot of it into play with some people. Spoke to a lady yesterday from Kansas who has cancer, and hopefully, there's my dog coming up to see me, Izzy, already. But anyway, so yeah, I'm gonna look at that. So I'm really into a lot of this stuff about, it kind of follows along with all the metabolic things that we do, because it turns out that regular cells really thrive on this thing called oxidative phosphorylation and um, utilizing oxygen for energy to make more ATP in your mitochondria. But cancer cells don't work that way. They really rely on the process called fermentation, and that's why they produce a lot of lactic acid. So if you can, in other words, cancer cells do not like oxygen, and they also do not like glucose and glutamine. So there's a nutritional way to really help yourself with cancer prevention and treatment. So just a really fascinating topic for me, and certainly hope that translates in a lot of useful information for a lot of people, because it seems like we're seeing a lot of cancer. We've made great strides with preventing heart disease, but not as much with cancer. And cancer is a metabolism problem, kind of like diabetes is. And so that's what I'm into right now, and a few of the reading things I'm doing. And so it's just interesting.
Yeah, I love that. And if you guys let me know if you want me to put that list up during the show here. See that from Denise. What's going on? Great to see you. Denise got a great little comment here. Thank you, Denise, for putting this up there.
It was good to see you the other night, Denise.
This is awesome. And I want to give a shout out to my man Greer and Jessica. You guys are with us live and are each week. And I got to see Greer and this past week. And one Greer, I'm thinking about everybody in the airports now. I hope everybody is safe. I know it's been a wild week for you guys, but thankfully you guys got my sister home safely last night. So thank you.
Greer, good job. Good job,
Yeah.
Greer. I couldn't believe she flew into Tri-Cities at 10:30 last night during this massive storm we had. But the comment about Denise, as a matter of fact, I'm going to be in West Palm Beach in February. So if it's the same week I'm there, I'll sure try to get by there. And the ozone as well that you're doing is fantastic treatment. So I hope that's the same week I'm already there. I go there for a professional tennis tournament every February, and I think Ben you may come. You may join me this year. But interesting. We'll have to talk about that.
Thank you, Denise, for putting that up there. We're going to get into some questions. We only had one come throughout the week, so we're going to quickly get into live Q&A. So if you have a question for Doc, go ahead and put it in the comments. Again, we're super appreciative that everyone's spending their evening with us tonight. If you don't know, we do this every single Tuesday at 7, taking live Q&A on any of your health and wellness questions. And this was a Methylene Blue question, which is a common topic that we get on the show. A couple things that stand out to me is one is the mention of weight as well as capsule form. I'll go ahead and read the question for the podcast listeners. What milligram do I take of Methylene Blue as a 185-pound man? And this is in capsule form. When I think of Methylene Blue, I do think of the drops. Tell me a little bit about the capsule form as well.
Yeah, you can get it in capsule form. I hope, we've ordered some for our office to dispense in capsule form along. It also has a little bit of vitamin C in it. When you take Methylene Blue, if you take vitamin C along with it, it makes it more absorbable. But so the capsule form certainly great. You could probably dose the drops a little more delicately if you wanted to, but I'm not sure there's a need to do that. And certainly don't want you to let your dogs get into Methylene Blue, because we'll try to flip up some pictures of my dogs when they got into Methylene Blue.
Oh, they'll be here.
Ruined carpets and hardwoods and their fur. But anyway, so it does stain things. But so actually how they originally found Methylene Blue back in 1860s. There were these textile chemists that were dyeing jeans, and they love to, chemists like to look at everything through a microscope. So when they put the methylene blue on the microscope, they noticed that it also outlined the various parts of a cell. And so to this day, we still use methylene blue to stain our slides to look at various organisms and parts of your cell. So, but the one thing they also noticed was that the methylene blue, they were able to identify the parasite that causes malaria, and which is a real breakthrough. But they further noticed that it killed the malaria parasite, and so actually it was the first treatment for malaria, and it's a precursor to hydroxychloroquine that's used millions and millions of times to cure malaria, and as well as a lot of other things. So methylene blue is one of those things that just fascinates me. I take it every day now, and it's very safe. You really don't need to. If you take a deep dive on this, you'll see some possible interactions like with SSRIs and MAO inhibitors, but it's really not a concern. But as far as the dose of it, you're 185-pound man. A lot of it depends on what you're taking it for. There's a lot of different uses. If you're just doing it for, you want to breathe better and have more energy and maybe focus a little better, you could get by with probably taking about a total of 16 milligrams a day. But if you do it milligrams per kg, I think 185 pounds is probably about 85 kgs, maybe kilograms. But it's dosed anywhere from 0.5 milligram per kilogram to all the way up to 3. So you could take, it just depends on what you're taking it for. But if it's for serious acute infections, like we use it for COVID and a lot of other acute infections, UTIs, things like that, we usually use about 32 milligrams for that. If it's Alzheimer's prevention, it's usually 16 milligram. Alzheimer's treatment, I use 32 milligram per day. And I usually like to split the dose up into twice a day. So it just depends. You can go way up on it, a lot higher than I used to think you could. But all I'm doing now, I do the drop form just because I have them, and it's a 0.5 milligram per drop. So I do 8 drops twice a day. So that's a low dose. Again, that's on the low side. But if you ever want to take a deep dive into it, and I think this guy may even have a podcast. He's an MD, Dr. Scott Scherr, I think's his name, Sherr. I think Annie may have heard him lecture in Las Vegas about a month ago at the A4M conference. But you can look his stuff up, and he's pretty much an expert on it and gives a lot of different dosing guidelines for various conditions. So I hope that helps you. But, if you do take the really high, real high doses, you may want to do that short term. It could still mess a little bit with your gut microbiome. If you do that, don't start out taking that much. Work your way up, titrate up. So I hope that helps you.
Thank you so much for that question around methylene blue. I just looked up that name. I want to make sure we get that right if anybody wants to dive a bit deeper on that. I see you on Instagram. Let's see here. Megan Inspirations, I got you. I can see your comment. If you guys want have questions over there on Instagram, put it in the comments. I can see those. I won't be able to put it on the screen, but I'll just read it out to Doc so we can get all y'all's questions answered as well. And Megan, we're going to start with you in just a second. Katie, what's going on? Great job today. Great job this week, everybody. Thank you for being here, Katie and Carter.
That reminds me of a great story to tell. I was doing telemedicine today, and I just get tickled at some of the things that I think about when I'm talking to people on the phone. And I went over a lot of Cleveland's today. It seemed like we did a lot of reviews of Cleveland's, and this one guy, he's about my age, so he's got some age on him for sure. And he had a really good Cleveland, very improved and over the years. And I congratulated him off of on his Cleveland, how well he was doing. And it just popped into my mind, and I told him this, and it kind of shocked him. But I said, mentally and physically, you are as healthy or probably healthier than the president of the United States.
Gosh.
And he was really pumped up about that.
We'll
I
leave
hope
it at
everybody's
that.
laughing. I hope everybody's laughing. I try not to get political with these things, but that made him really feel good that he was as mentally and physically as capable as the president of the U.S. So that's pretty much a compliment, I guess.
Uh, to be a fly on the wall.
I might
I
use
do
that more
see.
often. I mean, if it makes somebody feel better.
Hey, you know what? Yeah, Katie said you're not. I believe it. I believe every word of that. I think that's amazing. And I do think one thing that I'm catching from that is that your Cleveland can improve, and I think that's really cool. And that's one of the ways, one of the big things that I know we do in offices. People get those once or twice a year, and sometimes they can be a little discouraging at the beginning, but you can improve those, which is super cool.
Another patient tickled me too, because I was going over their Cleveland as well, and I guess we were talking about his cholesterol or something, and he goes, "My family doctor says this. Do you concur?" And I immediately thought about, it came to my mind, that movie that Leonardo DiCaprio was in, where, true story too, it's based off a true story, where he faked being different professions. Like he was an airline pilot and he wasn't even a pilot, but he pretended like he was. But he pretended like he was a doctor, and in order to impress this girl who was a nurse, this young girl. So he really didn't know anything about medicine. So he was the attending doctor at this teaching facility. So what he did was go around to the bedside with the interns and would ask them, "Dr. Smith, what do you think about this patient right here?" And the intern would rattle off, "Well, I think he has familial Mediterranean fever." And Leonardo would go, "I concur." So concurring may not mean anything. You could have a lot of people concur about a lot of things, but it just brought out that Catch Me If You Can. Great. That was a great
That's the
movie.
movie. Yep.
Loved it. I love that
love it.
movie. Thank you, Carol. But I got a big kick out of just that thing came up, that word concur came up in the medical setting. And I go, you got to be careful when you concur with something, because a lot of medicine is opinions. I'll tell you, like I was telling you last week, if anybody wants to hear a great podcast on what's happened to our medicine in the United States, our healthcare system, you really ought to listen to an episode of Joe Rogan, whether you like him or don't like him. He brings some interesting guests on, and this guy was named Bueller.
Oh, you guys can't see that. That one. There we go.
Yeah, there you go, Bueller. But that is a really good podcast. It's long. It's a little over 2 hours long. But if you listen to that, this Bueller guy is not a doctor, but he's been in healthcare for years. He gives the best summary of what's really happened to our healthcare system and who the bad guys are. Number one, the insurance companies are the real bad guys. They're the top of the list, the insurance companies. And then big pharma ranks up there. They do some good things, but they also are in cahoots when they buy out people. So they're probably number two bad guy. The government's probably number three, maybe hospitals number four. But he just talks about he's got a great description of the primary care business and why the primary care doctors just really can't be that good. It's almost impossible for them to be good at what they do. They're not trained right, and they don't have enough time to spend with you to get to the root of the problem. And they're searching for codes, and they're so burned out. They really, it's just a tough position. It's not that their own fault either, but I could just see that. What he was describing was me 20, 25, 30 years ago. And he made the statement that you really can't practice as a primary care doctor. You cannot practice good medicine unless you're a cash-based model. And I was going, yay, because that's what we've been doing for 18 years. And it was just I concurred with that. Okay. So anyway, listen to that podcast. It's a great summary. I wish everybody would listen to that. Anybody that's interested in health should listen to that. And especially physicians who are kind of hamstrung by this whole medical system that we practice in, that you really don't have to practice in, but 99% of them are doing it that way, and unfortunately. But anyway,
in the comments for those with us live, has anybody listened to that episode on the Joe Rogan Experience with Bueller? Let me look at this one more time. It's Brigham Bueller.
And it's not Ferris Bueller. That's another great movie that you should watch. But
Mason's asking what podcast is. It's the Joe Rogan Experience. So if you search Joe Rogan and Brigham Bueller, you'll see it. It is super educational, just around healthcare.
He nails it. He just absolutely nails it.
Yeah.
And a lot of the people that listen to this podcast, this Q&A, and listen to my podcast and actually come to see us, they think a little bit different than the average person does. We get a select group of patients that are really kind of more interested in this type of thing, cutting edge, preventive, proactive rather than reactive medicine. So it's a great podcast. Listen to. I recommend it.
And we'll keep putting that up, guys, if you guys want to check that out. I see Robin's in the building. Robin Riddle, what's going on? Starve, explain this. Our nurse practitioner in the West Knoxville office. Thank you so much for being with us tonight. Margot is in with us tonight, our PA over in Fountain City. Huge shout out to the Fountain City Clinic. And we're gonna get to the Instagram question. I see we got a few people in here. Megan, thank you so much for being patient with me over on Instagram. I'm going to just mention this for you, Doc, because I can't put the actual question up on screen. So this is over on Instagram. Megan is asking, I was wondering what it means if you have a low vitamin E gamma toco level, which I could be mispronouncing that, TOCO, but a normal vitamin E alpha toco. Does that make any sense? Am I pronouncing that right?
Yeah, wow, that's a good test that you got, because it's just separating the different forms of vitamin E, tocotrienols. So the alpha, you want the alpha or gamma forms of it. They're more natural, and if you're looking to reduce your cholesterol and through a natural way, I really like the mixed tocopherol. So those have several different types in it, and I've had some really good luck with bringing down cholesterol with those. We keep them in the office, but they're just kind of differentiating the different types of vitamin E is what they're doing. I haven't seen that test, but that's interesting. I really like to start doing that. Really, maybe I can get them to start running that on the Cleveland.
So you're saying it's okay if you have a low gamma versus a norm. You're looking at the alpha, correct?
Yeah, well, you're looking at alpha, delta, and gamma.
Okay.
And the delta gamma is the one I usually focus on.
Okay.
But there are some forms of alpha that are pretty good too. But usually, if you're getting these things from somewhere like Life Extension, you're getting a good one. And I'll have to, if I can get my multi down here, I'll tell you what form I put in mine. I know it's the best. So
Megan is saying the alpha was normal and the gamma was low.
Yeah,
okay. Megan, I hope that helps. What we'll do is I'm going to, we need to, I guess, figure out that test. It seems very useful. So thank you for bringing that up.
You probably need, there's some gamma, you can get gamma alone. I know that, but I'll see what I put in mine.
Is in your super?
It's in my super. I'm gonna need my glasses to read that. Can you read that?
I can. It says vitamin E as D-alpha tocopherol acetate, comma, as D-alpha.
The alpha is the one that I choose to put in mine. It's it's
But
really
you also
the,
have
and you
succinate.
like gammas too, but you can get the mixed with all of them in there. But um, yeah, the alpha is the best. The D alpha is the one that I prefer. So
Got it.
as long as that's normal, that's your most important one.
Got it.
If you're looking to bring down your cholesterol, you might want to get the mix with the gammas.
All
But I
right,
think
Megan.
Delta may be the one that they put in most vitamin E, and it's not as good.
Megan, I hope that helps. We're going to keep going. I'm going to go back over to Facebook here. Let's see. We got a couple questions come in. Darren, I see you. Let's see. I think Stan or Gwen. There we go, Gwen. All right. Gwen is asking, do you have any advice for shingles? I've been taking Valtrex for almost a week now. We're starting to get quite a few questions about shingles. So thank you, Gwen, for putting this up. I know this is helping more than just one person. What's going on with this?
Yeah, shingles can be rough. I've had one little episode of it myself, and fortunately got on Valtrex quickly. And also, I would take prednisone for a few days as well. I think that really helps it. When I see somebody with shingles, I immediately put them on both, because shingles will go away, but the neuropathy might not go away. They call it post-herpetic neuropathy. So what shingles is an old chickenpox reincarnation. They can come out for various reasons, stress, who knows. It can come out for no reason, but it's really painful, and it lasts for a while, at least a couple of weeks. But the sooner you treat it with Valtrex or acyclovir and prednisone, the quicker you're going to get better. You need to really tampen down that inflammatory response with prednisone. So, especially if it's on the face, it starts to get on the end of the nose or in the eye, it can be bad. I've seen some terrible cases of shingles for sure. So hit it hard. Don't worry about taking prednisone for a few days.
Gwen, I hope that helps. I hope you start to feel better. Let's get to Stan here. Type A flu seems more like a cold, but what can you do for the coughing that lasts for several weeks? Stan, we hope you start to feel better, man. What's your thoughts on this?
Yeah, I agree. And that cough can be really persistent. If an antihistamine doesn't work, like Zyrtec, and sometimes that does help a tickle cough. Sometimes I'll use something like Tessalon pearls. They're coughing pills that don't make you drowsy or anything like that. Mucinex may help a little bit. Mucinex tends to thin up the secretions that you get that can irritate the throat. So it may be like a tickle cough. Now, if it's a deep cough and you're coughing up stuff, you might even have to take a Z-Pack or a round of antibiotics, because even though it started out as a virus, you can get bacterial superinfections on top of that. So if you're not improving, I'd think about that. And and if you're wheezing or having a lot of inflammation, I'd even think about a few days of prednisone as well. And make sure that it's not reflux. You can always try Pepcid or something short term to see if it's a reflux cough. More than likely, it's just bronchial irritation from where you had the flu. But some people, like when Jenny gets something like that, she coughs for a month or more. Yeah. I mean, she coughs a lot. I've tried everything on her, even a round of steroids. Sometimes I even use inhalers, like Pulmicort inhalers that we use so much of during COVID. And that seems to calm it down. So if you're not clearing up, it needs to be looked at for sure.
Stan, I hope you feel better. Thank you for putting in that question. I know that's going around, so thank you for putting that in there. Let's get to Darren on Facebook. Been on Ozempic for 3 weeks at 0.25. My carb and sugar intake is very low, and my blood sugar is averaging 142, down from 280 at my first visit. Should I increase my Ozempic to 0.5? Darren, thank you so much for this question. This is
great question. Yeah, definitely. You should definitely go up. As a matter of fact, being a diabetic, anybody with 280 is a diabetic, needs to work their dose up higher. They say the maximum dose, but you'll probably, since you're having such a great response, go to, I always do 0.25 for 4 weeks, then 0.5 for 4 weeks, and then I'll go to 1. And sometimes I'll go to 2. It goes from 1 to 2. You see more nausea at 2. But yeah, try to work your way up to 1. And you're probably going to need just to stay on it as well. Still stay on your diet. But when you get on Ozempic or Mounjaro, you're just not going to be hungry, for one thing. Those cravings for carbs are going to go way down.
Yeah.
So congratulations. That's awesome.
Yeah.
I'm really pumped about the response of this new class of GLP-1 agonists. Are amazing. And then if that doesn't work, add the GIP Mounjaro, and work just as good or better.
Darren, thank you so much.
Work your dose up. That's too low a dose at 0.25.
Great job there, Darren. We're proud of you. Thank you for putting that in there. Let us know if that helps, if you need us to clarify anything. Let's go. Let's see here. I'm going to go to, where am I at? Let's see. All right. My brother Mark is with us tonight. Mark, I hope you're well, man. Let's see. I went to a rheumatologist last week. He spent 50 minutes with me. 45 was on a laptop. 5 minutes was the exam. Medicare regulations kept me from providing any of my meds. Insurance prevented ordering my labs. Am I reading that right, Mark? Let's see. I think this might be just a comment around the cash only thing. Okay. I think this was more comment around the more traditional model. Mark, am I wrong there? You seen anything, Doc?
I'm glad you got into a rheumatologist finally, but Medicare regs kept the rheumatologist from providing any of my meds. Insurance prevented ordering my labs. Okay. In other words, the Medicare, that doesn't make sense to me, really, to be honest with you. But, a doctor is an independent, you don't have to prescribe what Medicare says you have to. You can kind of think outside the box. That may be what he's talking about.
Oh, yeah.
I'm sure that, he probably wants to order his own labs and maybe, just kind of see what's going on with you. Maybe not as many labs as you'd like him to order, but interesting. That's a tough gig. There's one specialist that I'd hate to be in. It's a rheumatologist. And it's hard to get in to see them because there's just not many of them. Not that they can't do great things. They can, but most of the time, I won't say most of the time, but a lot of the times they can't tell you exactly what you have. And they don't tend to think outside the box too much because they're overworked, underpaid probably, and don't have time for it. Plus, they deal with a lot of chronic pain, to be honest with you, and a lot of really old people. So it's a tough gig,
Mark, I hope that helps a little bit. Thank you for putting that comment in. It does, go right along with what we were talking about with just, healthcare in general. Like we say every week, a lot of this is about taking control of your own health and doing the things that you have control over. And that's really how we hope you guys use this show, to educate yourself so you can go in when you go see your doctor with the right questions. Because there's a lot of different things that you can do. And, we obviously talk a lot about some of the outside the box stuff. So I appreciate you putting that in there.
Mark, maybe you should take a tape of Joe Rogan's interview with Mr. Bueller and get the rheumatologist to listen to it for 2.5 hours. You think he'd do that? Highly doubtful, but you can try.
Darren is loving the Freestyle Libre 2. Thank you for putting that in there.
Awesome.
We're huge fans of the Freestyle Libre. Let's see here. I think caught up. I'm going to put up Jody's question here. What to do with dry heat, headaches, sinus infections? I do keep humidifier on. This is, obviously very common right now.
Yeah, that's a
What's your thoughts on
toughie. I
this?
suffer with that too. I really dry out easily. So avoid taking antihistamines if you're on that. Drink a lot of water. Keep your humidifier on, but make sure you clean your humidifier, because if you don't, you're just spewing out funguses and everything else. You may even try doing some sinus rinses with a Navage, which I really like mine, with sinus irrigations. Keep a lot of moisture on your skin through CeraVe or some of the better moisturizers. But it's kind of a tough gig. It really is. I like to put coconut oil on my skin. I have really dry skin.
Yeah.
So moisturize, drink a lot of water, and make sure you get enough electrolytes as well. One thing that really helps me is my infrared sauna, and a cold shower. It really opens up my sweat glands a lot. And I always use sweat cream in there, which is mostly coconut oil.
Super interesting. Jody, thank you for putting that in there. I've even noticed myself getting some dry skin with the cold. So thank you for
Or go down to South Florida. My skin didn't bother me a bit down there in the winter.
I'm going to put this up here from Denise. Thank you for this comment, Denise, for the shingles question. We've used IV ozone to knock out shingles quickly. So thank you for.
But IV ozone is a really interesting product.
Yeah, super.
I'm glad Denise is somebody around here doing it.
Yeah.
Interesting.
Thank you for that, Denise. Let's see here. Let's see. I know Mark sent us some stuff around the rice diet. Huge resurgence in Duke University rice diet for health conditions from long COVID to heart disease. You have any thoughts on this rice diet, Doc?
Yeah, I think Mark sent me some stuff on that. It looked pretty promising. And if somebody like Duke's looking into it, then that's just amazing. I don't have any experience in using it, but certainly I've read the stuff and it sounds really promising. Really interesting.
Mark, thank you for putting that in there. I think I'm up to date on questions, guys. If you guys have a question for Doc, we're going to be here for just a little while longer. You can put it in the comments. Real quick, I do want to ask you about the greenhouse with our good friend Jonathan. Tell me, what did you kind of pick up from that? Because I know you have one of these boxes. What's your thoughts? Was it a really? It was bigger than what we saw on camera. Is that right?
Well, one thing I picked up was is Jonathan's just a really good human being. He cares a lot about people, and his mission is really to help people start eating things that are clean.
Yeah.
Instead of all the junk food that we do eat. It's changed his health around a lot. And it's just amazing that when you go in a place that big and that impressive, you just feel better.
Yeah.
And the day I was in there, one reason there's so much noise during that, it was pouring rain.
Yeah.
And windy and all, and they have all the fans in there, so it's kind of noisy. But also that organic smell. And that soil that he uses for these plants has been around nourishing plants and flowers for like 40 years. So it's really like gold as far as what he's growing this stuff in. And it's just really cool the way that he talked about it. And, everybody is kind of worried now, not to be conspiracy theorist or anything, but a lot of people are worried about the supply chain and, whether or not we're going to be able to get decent food because of the supply chain may end or at least have pauses in it. So, boy, what a nice thing and what a nice thought that he had.
Yeah.
I haven't heard of anybody else doing this, to have your own indoor garden in your house that lasts for a month or two. And there's no fertilizers in it. And The seeds he uses are good. He just keeps repopulating them. It's not, I'm reading that book on seeds right now and what they put in them. It's kind of scary. Uh, so it's just really comforting to know that you can pick indoors out of your own garden. I
There's
don't know
seeds
if you
of
have
deception.
any pictures of his boxes that he actually made me one for Christmas, and that's why I thought about doing a podcast with him. But I mean, just about every vegetable you can think about, you can get in the box. And the other thing is, he if you want to, he'll provide fresh eggs in there in your box as well. And
I picked up a lot from that episode. One thing is just one, wherever you are, getting to know your local farmers, and kind of paying attention to, where your food starts to where it ends. It's really interesting. Just being more and more intentional about what you put in your mouth. And I think, I think we're heading in that direction. And Jonathan just has a beautiful thing going on. You can tell just by listening to him how passionate he is
he's a grower. I
about
told
it.
him he has the greenest green thumb I've ever seen. He
He
really
does.
does. I've known him for years, whether it be lawn care, landscaping, and now with the gardens and things. But even I asked him about the grocery stores and all, and he says by the time it gets in the grocery stores, it's probably, especially this time of year, it's probably coming from Mexico, California, Florida. It's not really that fresh.
Yeah.
It's going to have preservatives in it. So if you can get something without preservatives that grows right in this rich soil in your house, then it's just an amazing thing to me. And I can really tell a difference. I can tell you when I go over and pick some of my own and rinse it off, it tastes so much better than what I buy from the grocery, because it's usually when you buy from the grocery, it's in a plastic bag. And it's just, you can almost taste the plastic. You really can. Kind of like when you drink bottled water from a
Yeah.
plastic uh, jug or water bottle. It's just, we live in a very toxic world, and all you really need to be doing everything you can to eat fresh. And there's nobody that can argue that eating vegetables is not good for you, unless your gut can't handle it, and usually that's a problem with your own gut. It's not really a problem from the vegetables themselves. So it's just really interesting. I hope everybody will listen to that podcast that we put out from today. I need to get him back on there and see. But these things are very affordable, and it's just a great thing he's doing. I'm going to keep going and keep it resupplied all the time.
Well, I think that the big takeaway is just being intentional about where your food comes from, and and I think he has such great insight into that. So shout out to Jonathan Hauser. Thank you so much for coming on. I see Mark has a methylene blue question, which I dig. I'm going to put this up there, and then I see Velma's question. Thank you guys for putting that in. I'm going to answer that with Molly as well. New use of methylene blue and red light cone therapy to treat antibiotic-resistant mycoplasma for humans and dogs. Any thoughts on this, Doc?
Yeah, that's a good combination. Red light therapy is just amazing from many ways. What red light does, and I have one in my infrared sauna and I have a handheld. What it does is it kind of activates your mitochondria to produce more ATP, and in combination with other medicines like methylene blue, it's just an amazing synergistic effect. I'm probably going to end up buying a red light blanket. You see them at all these conferences we go to, and you can get under them, and then you can almost feel it working, immediately. You don't have to wait long before you get results. But red light therapy is just amazing, and certainly combined with methylene blue, what a great treatment for your mitochondria.
Thank you for putting that in there, Mark. That is a combination we got to talk more about. We haven't explained this episode with Robin on red light therapy. You can combine that with our couple episodes on methylene blue. So Mark, thank you for putting that in there. I see my buddy Brandon's in the building. Speaking of somebody who eats extremely clean, Brandon's with us tonight. Huge shout out to Brandon, the entire Allen household. We got Molly's asking about Jonathan. And to be honest with you, Molly, I don't know. But
okay. I know. It's just, it is former Torbett who was there for many years and just got old enough to where he couldn't do it anymore, apparently, the Torbett family. So, yes, it's the same place. It's in Piney Flats.
Yeah. All right. Thank you. Thank you, Molly, for putting that in there. Let's get to, Stan, I know we're going to have a very limited staff tomorrow. I think we're doing telehealth.
We may, it just depends. We may have more of a staff than we think.
We're kind of taking it hour by hour, but we're going to do the best we can, Stan. I promise you that. And if you need to, just shoot a DM over on Facebook, and we'll try to help you out in any way that we can. Let's get to Velma here. 88-year-old sister has problem with acid reflux, has used most of the common medications. Is there anything else she can do? Nothing is helping.
Yeah, the first thing I'll look at is, what may be causing the reflux. Is it a hiatal hernia? Is it some food or drink like coffee, caffeine, anything acidy, citrus type things? So if you can look and try to find out what the cause of it is, sometimes that upper esophageal sphincter gets, a little bit lax, and it lets some of the acid from the stomach get into the esophagus and causes problems, certainly causes reflux, heartburn. But assuming, you've tried the diet and you've gone from Pepcid to Prilosec to Nexium, and again, you don't want to use those forever. You'd rather find the root cause of the problem. But some people have a large hiatal hernia. Some people even have a Barrett's esophagus that require chronic antacids, because the benefits of that outweighs the risk. And especially if she's 88 years old and miserable, there needs to be something. Now, a couple things that are more heavy hitters is a medicine called Dexilant. That's the heaviest heavy duty PPI that there is. I've seen it work when nothing else would work. Sometimes I'll use an old-timey medicine like Carafate. Sometimes if you get into the herbal stuff, slippery elm bark is pretty good. Ginger can help. But certainly look at the diet first, and you might even want to, if you've had it for severe reflux for a long time, you've probably had an EGD or a scope to look in there and see if you have a Barrett's esophagus or a large hiatal hernia. So hopefully you've done that already. And also don't eat and lay down. Everybody knows that. And at nighttime, keep the head of your bed elevated. But Dexilant, Carafate are two things that you may consider adding if nothing else has worked. So I hope that helps you.
Velma, I hope that helps. Thank you for putting that question in there for your sister. Let us know if there's if that does help. And I see Allison over at the Blakes with us tonight. Hope you're staying warm tonight, Allison. Thank you so much for hanging out with us. Huge shout out to the Blake. You guys are the best. Doc, I think we're through the questions. We'll take any last minute ones. If you have one, then we're going to jump out of here. Oh, there we go. This is a picture from Jonathan's greenhouse. That's super cool. Oh, there we go. Look at that. We do got some pictures. Thank you. Look at that. And is that all vegetables?
Look at how pretty that is. Yeah.
Dang, that's pretty cool.
All of it.
That's incredible. And yeah, you're right, Molly. Off Torbett Lane there. Super cool. Thank you, team, for putting that up there for us. You know what? I think we should just put this up. I'm with you, Doc. It kind of makes me feel healthy just looking at it.
Yeah, especially when you're in there, the smells are great and you just feel better.
That's phenomenal. That is phenomenal.
That's one cure for dry skin too. Get in there and spend some time. Your
Yep.
skin's not going to be drying there.
Yeah. Well, thank you, team, for putting that up there. That was super, super, super helpful. I hope that I hope that makes everyone in here feel a little healthier. That's awesome. Brian, I saw you over there on Instagram, man. Thank you for being with us on Instagram and see Facebook here. I'm gonna get your question in. I'm sorry if I missed it over there. Brian is asking, is there any difference between compounded tirzepatide and name brand Zepbound?
Yeah. Zepbound is the weight loss version of Monjaro. Same exact thing. The compounded tirzepatides has to be a little bit different, either in there has to be a little sometimes they'll add a little something into it like a vitamin or use different dosing because really compounders can't make something identical to the brand name unless there's a shortage. And that's one reason why we've been able to use tirzepatide compounded and semaglutide compounded because there's been a shortage. So it's there is a subtle difference, but we've used a ton of it and it works. I've had a couple people tell me, well, I didn't get quite the same effect as I did on Monjaro, or in the case of semaglutide, I didn't get quite what I did with Ozempic, but it's very rare that I hear that. One of the main things is you're drawing it from a vial. It's not as fancy as a pen and all, so you have to get the dose right. But that's good. It's helped you lose 80 pounds. Isn't that amazing?
That's incredible.
There was a great article that I clipped out of the Wall Street Journal this past week, and it was a guy that had a very interesting commentary on how he'd battled his whole life obesity and how he was how he'd done so well on this, and he was questioning himself whether he needed to continue it. It was expensive, and the thoughts around the social aspect of being leaner. It was just a really good discussion on the use of it. And from my experience, you need to people that have metabolic syndrome and obesity, it's a metabolism problem. You need to stay on the medicine. Now, some people I've been able to keep on a relatively smaller doses than the main one, than the top dose. But it's a really interesting article about how he's come to view himself. He no longer is thinking about eating all the time. Those people are not lazy. They have a metabolism problem. It's different than somebody else's.
Look at this from Brian. This is incredible. Ran your first race last week and not going back. Man, that's incredible, Brian. We're so darn proud of you.
It's so encouraging to lose that amount of weight in a relatively short period of time. I think it really helps you psychologically to want to, think about what you eat. And that goes for anything, really.
Yeah.
So I like fast weight loss. I don't like slow weight loss. I think fast loss works better in contrast to what we've been taught. So
it's super interesting.
Congratulations.
Brian,
that's awesome.
Brian, thank you so much for sharing. I know that is that's encouraging. There's 59 people with us tonight, and I hope that encourages someone in here. And Brian, that's all you, man. Thank you so much.
And you probably want to stay on some kind of dose of that. Because 85% of the people, if they stop it, they regain their weight. So there is a 15%. So, and that's very similar to what any diet, most diets ultimately fail. They all work, they all fail. So, sometimes though, knowledge of, what to eat, like lower carbs for the most part, and also like intermittent fasting. That's really been a game changer for a lot of my patients. So not for everybody, but for a lot of them.
Brian, thank you so much, man. We really do. We're so darn proud of you. Grandma Mary, thank you. My grandmother thinks this show is incredible. So thank you. Molly, thank you. Guys, we're going to call it a night. Doc, thank you for doing this with me tonight on this cold evening.
Yeah.
Man, we do this every single Tuesday at 7. It would mean the world to me. There's 57 of you with us right now. If you guys could come back and hang out with us again next week, that'd mean the world to me. We'll be here. I think we're on the Diabetes Tour Guide. We're on the Performance Medicine YouTube channel, as well as Dr. Rogers' LinkedIn, Performance Medicine Facebook, as well as Instagram. So thank you guys for hanging out with us on whatever channel you're on. We certainly do appreciate you. And I think we're going to call it a show. We ready?
Yes, been fun. Thanks, Ben.
Love you guys. Thank y'all so much. Montana, thank you. We love you. Thank you so much. To all of our team, we love you guys. Thank you for all the stuff that you're doing in the office and taking care of everybody. We appreciate y'all so much. Stay warm, everybody. We will see y'all next week. Stan, Becky, Karen, we love you. We love you. All right, we're going to get my outro here.
The dogs are out in the snow, so you'll see them next week.
Dogs are playing in the snow. You guys will see them next week. Papa, I love you, man. Thank you.
Love you too, man. See you.
Don't go away.